Kaushik is going to speak on how to manage the unhappy patient.
Thank you so much, Srini. I think this has become like a yearly pilgrimage for us. Brilliant surgeons may come up with brilliant surgeries, but you may still have patients like this. So this is a 58-year-old who's worked as a purchase manager in a hospital. So the assumption is he knows something about cataract, something about IOL. He's a diabetic on control, and he's had blurred vision for 6 months. So he lands up in our clinic, and he's told by the doctor, you have a cataract. Now in his mind, he's got questions of how long is the recovery, when can I travel, do I need to wear glasses, what can I do? So the doctor very clearly, and this happens in almost all our clinics, where we say that after surgery, you will see very clear, don't worry with glasses. Do you have any questions? Otherwise, my counselor will guide you. The patient is overwhelmed because he's been told he has a surgery and he needs to get it done. And he says, perfect doctor, no problem, I've understood everything, and he walks away from the clinic. Now he lands up with a counselor. This typically happens in large practices where the counselor is telling him what are all the options that are there. They tell them you can have topical, you can have block, Indian, imported, single piece, toric, whether you want faster recovery, small incision, large incision, there are other options. But then we think that this particular IOL will suit you. The patient is completely confused. He is overwhelmed with the amount of information that is landing into his head. Now he has taken a leap of faith and he's decided to get a surgery done. And then he Googles up the hospital name and he reads a report where he finds that there's a report of a particular IOL that the hospital has used, and they found that there are better incomes. And then he's sitting in the block room and he notices that the person next to him has got that same box that has a label that he read in the paper, but his label is not the same. Now he's a little confused, saying that they've said that this particular lens is very good, but why is it that I have a different color lens? He anyway gets his surgery done. He's reading 6/6 on the first post-operative day. The surgery was perfectly okay. The quality of care was perfect. He has no complaints at all, but he's got some doubts in his mind. So this is something that does happen. Often as surgeons, we may not be aware about it, but talk to your staff. There will be many a patient that happens every year. When an unhappy patient happens, this is something that the psychologists use for surgeries. Largely it's been used in aesthetic surgery. It's a mnemonic called BLAST, which says that believe, listen, apologize, satisfy, and thank. So first you need to believe that the patient has a problem. So you approach him, you tell him saying that I believe you're unhappy and I want to understand what happened, because often there is a miscommunication that's happened. Next is you need to listen. And listening is active listening, where you're not looking at your phone or you're looking at the computer doing an entry, but actually having an eye contact with the patient, nodding your head to appear that you're understanding, and you paraphrase saying that I understand what you're saying is very frustrating and that you were not told about the IOL options or why this particular IOL was told to you. Then you have to apologize. In our business, the patient is always right. There are no two qualms about it. I apologize that you are upset about us not reiterating the options and just handing over a sheet of paper that said what IOL and what estimate, and then go on to explain saying why the judgment was done. It's not too late to salvage it. For your condition, you're a diabetic, so the other lenses were possibly not useful because your contrast would have dropped. Therefore, we thought the monofocal is the best, and we think in the long term this is going to do something very good for you. Anyway, you can see very happy. You've been used to wearing progressive glasses, so there's going to be no problem for it. And at this point in time, we thank him saying that, okay, we hope that you've got all your answers. And we were in the process at this point in time of working with Microsoft and building a chatbot, and we kind of handed it over to this patient. So today, PREMs are something that are becoming in vogue. So you will see with accreditation that this comes in more and more into practice. These essentially are tools or instruments that look at the satisfaction rate that capture it from the patient's point of view. So typically it will have questions like, were you informed about your eye condition and the expected improvement? Were you informed about the various options that you had? Did the staff inform you about the cost of treatment? Were you explained about the surgical procedure before you actually signed the consent? So these actually tell you how adherent the staff are to our SOPs, and this kind of adds some method to that madness and make sure that what we intend to do is actually getting done. Knowledge, we assume that the patient knows because we've told them, the counselors told them, they've signed a consent form, but we need to understand that there is a possibility that they could be misinformed by the staff. They may be told that you will be completely glass-free while you're using an EDOF, where 80% of their activities, possibly they're going to be glass-free. They may have a misperception because they've been told by their friend that once they got the surgery done, their vision was brilliant, but they don't realize that they have a retinal pathology that may not allow them to have that same kind of an outcome. And of course, only about 37% of them in various studies have been shown to retain whatever information that they have. So what we've done is we've deployed this bot in our hospital and we've kind of validated it now. This shows the point of view of the patient and of the surgeon. This runs on WhatsApp. This is a GPT-4 based application where the patient is provided this solution from the time they counsel for surgery and until 1 week post-operatively. So they put in a question almost instantaneously in a few seconds. Currently we use an open key, so it takes about 7 to 8 seconds. They get an answer with a question mark. This is what the bot has generated based on our curated knowledge base. The same question comes to the doctor. He can then validate saying that the answer is correct. The minute they type yes, you would see the question mark turn green there. So the patient is thrilled to bits about his answer coming and it getting validated. So what we've realized over time is that only about 55% of patients are known to have discussed IOL options. They just go by what they're told. And 75%, despite being told, understand what they have to be done. So it is very, very important that the content that we deliver is more related to the patient and we kind of understand what their expectations are. Otherwise, this imbalance is bound to be there. So these are again some of the questions that came up and what answers that the bot generated. Again, the brilliant surgeons have showcased what surgeries are done. For the surgeon, this may be one among the list of surgeries that they do in the day. But I think it is very important for us to humanize it and not treat our patients as a cataract case. And remember that it may be their first and only surgery that they will undertake in their life. So thank you so much again, Srini, for making us part of this IC.
Yeah.